everyone. Welcome. Happy Friday to everyone attending live. And welcome back to everyone coming on to our recorded session. So happy that you came on to join us today. Today, I'm going to be speaking with Diana Thompson. Most of us in the massage world know her very well from her Hands Heal book. I'm going to apologize to her already. I have the 4th edition. I don't have the 5th on me. There's a 5th edition. We'll talk about that. She has been in the field for over 30 years. She brings her expertise to the world of massage therapy in form of documentation advocacy, research advocacy, just sharing her knowledge and her passion with everyone. And I can't wait for everyone to get to meet her a little bit more. So without further ado, I'm going to welcome in Diana. Hello, Diana. I have a new extra. Hey, welcome. You're my first confetti person. I'm very excited about that. I had this new edition this week, so I'm really excited to welcome you with some confetti.
Yay.
Yay. Awesome. Thanks for joining me. I'm really happy to have you on. I have attended a couple of your classes back in the day over the years, and I've really enjoyed all the knowledge I've gained from your classes. And I was so happy when you said you'd be able to join us and talk about not only documentation, but your software that supports supports therapists to better document as well. And so we're going to talk about all the transformation that's happened and the progression that's happened over the years for that. So I know you've been in the field for over 30 years now. So tell us a little bit about how you got into the field back in the day.
Oh my gosh. Back in the day, I had taken a course in manual testing to test for different conditions that my mother had bought me while I was on break from college, my freshman year. And I loved it so much. I went back and started studying massage and doing massage in the training rooms at college, and did it for various sports teams. Then when I graduated from college and moved up here to Seattle, I went to a massage school and got my license in 1984 and have been doing pretty much nothing but massage ever since. So It's been a great career. There are certain times where you just know that there's something out there that you're supposed to be doing. And magically you meet the right person that shows you the needs in the profession. And you say, someone's got to do that. It might as well be me. So.
Wow. I like that attitude. I feel I can relate to that. My husband's not so happy about that too much because he doesn't want me to keep signing up for things. But I know that feeling. It's like, well, I see a need and let me jump into it. So, and I just like kind of recapping on your website and reminding myself of all the places I've seen you over the years. I've only been in the field about 20 years, a little shy of where you've been. But you've been very visible in the community with AMTA, American Massage Therapy Association, Massage Therapy Foundation. I saw some interviews with you at the Alliance for Massage Therapy Education. I probably anything related to massage, you've had your hand in either with helping out or providing some information or being the president of. And so that kind of does speak to what you just said about seeing a need, jumping in there. Tell us a little bit how you got into all of the organizations. Is it, I guess the timeline. So did you start kind of jumping into things and then the book kind of came about, or how was kind of your transformation there?
I started out in sports massage. I went to specific injury massage after getting in a couple of car accidents and personally feeling the need. And from there, it was really an invitation to look at research and how documentation can help with research. And with car accidents, I met an attorney and we would teach classes on how to chart for personal injury cases, how to bill insurance. And that grew into writing the book because you could only teach so many people, right?
Right.
And then you start to have to reach a broader audience. And that was before a lot of internet communication. So writing a book was the next best thing. So after writing a book, then it was using the book to help out researchers in documenting research so that they could really track progress over time and show the effectiveness of massage therapy. And from working with research organizations to getting a call from the president of the Massage Therapy Foundation saying you should be on our board, because I had been donating to them since the beginning. And so that was an incredible journey and personal growth experience and professional growth experience, getting to go to research conferences all over the world.
Yeah, I can really imagine. That's really amazing. Especially, I was just talking to students recently about it because we have a class called case studies where they see a person through their entire duration of their program, and they need to have some documentation and research follow up and kind of use it for different purposes. And I'm saying, back in my day, I do that a lot. The whole uphill both ways in the snow kind of thing. There was only a little bit out there of research in massage, and it was, a lot of it was related to what physical therapists did for manual therapies, not necessarily massage therapy. So I can only imagine you being right in the middle of it with the Massage Therapy Foundation, but just seeing it from my end, how it's exploded over the last maybe 20-ish years, probably so much more that's out there. And we have to credit a lot to our pioneers such as you for the documentation for us to get to that point. But was it easy to get to? And what are some of our obstacles there to be?
Oh my gosh. The obstacles were really inside the profession. The encouragement happened outside the profession. So every time I would go to a research conference, there were all kinds of allopathic medical providers there, as well as alternative is what we called them in the beginning, or complementary now. And they would always say, you show us 6 months worth of charts on every client and we'll start referring to massage. And so charting was one big stop for people to refer to massage. The second one was the research. And the president at the time, John Boletta, when I first came in, he was completely dedicated to massage research done by massage therapists for massage therapy, so that it wasn't about physical therapy. It wasn't about nurses doing massage therapy, that it was really educated touch beyond that which a family member could do. And so that made a big difference. I also think the big push had to be bringing massage therapy into integrative healthcare. That if we're really going to get referrals from healthcare providers, we had to be a part of healthcare. And you can't name me a healthcare provider that doesn't chart their sessions. Right?
Yeah.
If we're going to get referrals, that puts us in the classification of specialists, right? And if we're specialists and we get a referral and we don't report back to the doctor what happened, then they should not be left searching for us, trying to figure out what happened to that referral. Did you even go? What did they find out? They shouldn't have to hear it from the patient.
Especially patients what's the word? Their interpretation of what they were told to. We know that always can be really interesting when they don't know the technical language and things like that.
Like, I just feel so much better.
Right.
Like, I don't know why I feel better, but
yeah,
it's interesting that today's massage therapists have the benefit of getting a lot of walk-ins or referrals or people that just feel good about taking themselves to a massage therapist. And early on, nobody would go to a massage therapist unless they were rich and it was a luxury, or unless they had had a regenerative or rehabilitative session before and believed it could do some good. But once doctors and other healthcare professionals started referring to massage therapists, it made it okay.
Yeah.
And we've done little, I think, to maintain that, in that I think, and probably not your school, right? Or any of the great schools out there, but they often either teach charting as an afterthought. It's like the last month of school. It's like, oh yeah, and you have to learn how to chart if you're going to bill insurance, which is so not true.
Right.
I mean, if you're a healthcare provider, you have to chart every single session. And what you should be learning from day one is, what's the difference between charting somebody who's healthy and charting somebody who needs treatment? That they're there to change what they're presenting with. They come in with a certain symptom or condition, and they want that to be different when they leave.
Right.
So I think it comes from internally, and then once you get out there and you see that other people aren't charting, it becomes okay not to chart.
Yeah, I noticed that. And I know people like, well, I work in a spa environment, so I won't see these people ever again. So what do I need to chart? Or they're not set up for it. You know, the turnaround time is very short, and there's not a filing system, that kind of thing. It's like they're in the billing system, but that's about it. And so that does make it challenging. And then other people thinking, well, only if I get sued or the person gets sued and needs documentation is the only time I need to do it. But that's, you know, there's so many other reasons for it. And one you just said about increasing the our position in the field of massage therapy and healthcare, right, by being able to document those changes. But even though you said the two kinds of people that we're seeing, either people are healthy or not, even the people who are healthy, I tell my students all the time, they still come in and say what they're looking for. And at the end, you still have to decide, did you meet those needs or not? And so there is still a purpose for that documenting, because they might come in and I don't know a single person on my table who hasn't come in and said they're stiff somewhere or a little achy here or just want to relax or sleep better or whatever it might be. So there's never not a need for that kind of approach. Do you agree?
Yes. And stress can cause all kinds of health problems. And if somebody needs to relax, more likely than not, they're stressed out for some reason. So it's important for us to help them figure out what that is and how to live with it differently in their body.
Yeah, absolutely. Yeah. So you wrote the book to basically help reach more people. And so you're on the 5th edition now, I believe, right? And that was in 2018. It sounds like a few years. Is there any additions, updates coming soon, or are we pretty good with where you are now?
I think I'm so focused on the electronic version. And it's been out for a few years, but you're always spending the first 5 or 6 years improving things. Things change so quickly in technology, and you find out more and more what's needed in the profession. So, so I haven't thought about another edition for a bit.
No, that makes sense. Absolutely. You're like, please don't give me more work to do. I'm good.
I know, not right now.
So a couple of things. So one, in the book, and like I said, I have the 4th edition, but the 5th edition is out, and it was Lippincott Williams, and now they're Walters Kluwer. Is that how you pronounce it?
Right.
With that, a lot of it I know does talk about insurance billing, and you mentioned that as well. And I know you're in Washington, where health massage therapists can bill for insurance on some insurance plans, right? So I know of people who say, "Well, I don't live in Washington, so what's the big deal for me?" kind of thing. But in the book, there's still a lot of relatable material to any massage therapist, any place where they practice, right? What are some of the key highlights that you'd see in the book, and then we'll kind of transition to the software?
I think what I really try and focus on is all the different ways you can chart.
Mm-hmm.
You can draw on pictures.
Mm-hmm.
You can do measurable outcomes and show progress.
Mm-hmm.
I think showing progress, regardless of the type of person that's the needs of the person that are coming in, they want to know that their money's well spent.
Mm-hmm.
And if they can have something that really demonstrates that progress in a tangible way, I think that means more to them. So that's
Right.
important. I also think it's important to know how to communicate with the healthcare team.
Mm-hmm.
That if you do happen to receive a recommendation or a referral or even a prescription from a healthcare provider, there's a need to communicate back.
Yeah.
And I don't think we always do that. So I want to really impart the importance, but also the simplicity
Yeah.
of
Yeah.
referring back.
It's
Of
almost
sending
like I have a 9-year-old and I'm always telling him about thank you cards. I mean, it's almost like that. Like it's so simple, but so forgotten at the same time, like to have that communication open. And I love that you brought that up, because I was just talking to someone about this the other day about getting, doctor's notes for different cases and things. And I like how you worded opening up communication with the healthcare team. And so I like that approach better than getting permission from a doctor to work on a certain condition. I like more opening up conversation, discussing your part of the healthcare plan, and kind of having that open sense of communication, because that's where we're all working together to try to collaborate to get this person better ultimately, right? And so that gives us an opportunity to create the documentation communication format, and also be taken seriously and have more credibility that way as well. Right? Yeah,
It's true. And I think they want to communicate with us, and we should not be intimidated by talking to them.
Yeah. Yeah, that's sometimes hard, right? Someone has a MD at the end of their name, or a NP or something, and it sounds a little scary, but they're people too.
And they need our help.
Yes. Yeah.
They don't spend nearly the amount of time, and people tell us so much more than they tell their doctors.
Yeah. 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 I was just reading actually from a different book on oncology massage, and they were talking about being part of the healthcare team, and that's very same thing. They tend to talk to us a bit. Some of them are talking on the table. Our clients are talking throughout their session, and you're hearing more about things that they might not be able to relate in a shorter doctor's visit, or a visit that's more related to one specific part of their treatment plan. So we have a lot to say and a lot to bring to the table.
We do.
Yeah, got to wear that with pride.
That's right.
Sure. Yes. So you had mentioned the software, and I know I attended a ABMP school summit 3 years ago now, I think it is, in San Diego, and I had first heard about it then from you. And so it's let's see if I can. It's Hands Heal. I want to put the information here. Hands Heal EHR. So electronic health records, right? And it's basically the book in the software version, right? But tell us a little bit about it. What are we actually going to see there, and what is the service?
Yeah, I think the best thing about going electronic is not only do you have everything in one place that follows you wherever you go, and you can do it on your phone, you can do it on a pad, you can do it on a desktop or a laptop, and it's always available. It's also got all the options that you need for charting. So people who just wanted to write or draw on figures can do that.
Okay.
If you wanted to add in the measurement tools, you can do that. If you are doing simple, I say wellness massage, but yes, relaxation, stress. You can say what you did, where you did it, for how long, and at least you've got the minimum required by law. If you've got a condition that you're really wanting to make change in, then it's got sections by topics and not by categories. So it's not SOAP in electronic health records.
Okay.
When you look at Epic or any of the other big ones that the hospitals or physicians are using, they don't use SOAP charting anymore. They've got all the topics that they need so they don't forget anything. So this way we can say, what does the client present with? What did you find? What treatment did you do and where? And for how long? And why did you do that? Why did you choose that? And what do you want the client to do in between time? So you can set goals in there. You could chart as much as you want or as little as you want. But if you just do the wellness section, you'll at least meet the requirements by law.
Nice. So you said something in there I want to pick up on before I dive further into the actual software. So you said the things you want them to do in between. And I know I emailed you ahead of time because I wanted to bring this up because we were talking about this. And I think it's one of those great areas for a lot of people and a lot of therapists. I asked 3 people in a row and each one gave me a different answer, and they've been in the field for many years. And it's so if we're talking about the traditional SOAP or SOAP, that plan, what do we actually put in there? What can we actually say? What are we prescribing? Are we suggesting? It's like this whole can of worms that we could open, and we're kind of nervous about doing the wrong thing, but we want our clients to take control of their healthcare, be a part of their healing. And so what can we do? What can't we do? And is it a simple answer that Diana Thompson can fix for us right here, right now?
Well, I certainly can give you my opinion, but I really want to take one thing that you said about suggest and prescribe. In the state of Washington, we're very proactive, right? And we feel like we do things first and test them out, and then the rest of the country should pick them up. Right? Because we think we know what's best.
I'm laughing because my boss is from Washington and she's probably chuckling right now in her office.
It's sad but true. And we created a new definition in our state rules for massage therapists that says we can assess or evaluate, that it's not a diagnosis. But if we can't do that, then how do we know we're doing a safe treatment?
Right.
How can we work with somebody if we don't know what their range of motion is, their posture is, the tissues feel like, what's going on underneath that skin, and what are their symptoms? So we're always doing assessment, treating, and then reassessing so that we can tell, are we doing something that's working?
Right.
Do we need to change our plan? So I think of those things as necessary in order to treat, which makes plan very much about what do we want to do next time and why? Why did we choose what we did? What worked? What didn't work? What do we want to do next time? Right. And what do we want clients to do in between time? So I've had many insurance companies say to me, look, if you need to train them how to take care of themselves, we'll give you 3 more sessions to do that. We just don't want people to get addicted to massage, right?
Too late.
I know. It was kind of their biggest worry, but it was so much about, please teach them to take care of themselves. And if you don't teach them in a way that you know they're doing it safely, and it's not this suggestion related to something that your uncle's best friend told you. You know, it's you have to do it professionally. You have to document it in a way that the client can refer back to it and know what they did, which kind of leads us to something you said earlier about the electronic system. When you can upload, sorry,
it's okay.
I get so excited.
Yeah.
Well, I got on my soapbox there. That's right. If you can upload a picture of the exercise or a diagram or a little video showing them how to do something, they're more likely to do it correctly. Like, you don't want the client. All right, now I'm gonna last resort.
Okay. I know some tap dancing too, so I can always break to a little dance if we need a moment.
Okay.
It's live, folks. You never know what's going to happen.
I know. What was I saying? Upload a video.
Yeah, show them how to do it correctly and make sure they're not hurting themselves.
Right. Then they're less likely to come back and say, look, I burned myself with the ice pack. You didn't tell me that could happen. But if you've got something pre-thought out, prepared, you can attach it to their chart. They can log in, download it, look at it.
Yeah. That's a really great, I like that tool to be able to have. So how do we know what we can and can't do? So I'm thinking back in my golden years, we had people said you can't do any strengthening things because we're not licensed to do strength training unless you're a physical therapist or a athletic trainer. But stretching is okay because it's in our scope, and in Arizona, it is written in our scope that we're allowed to stretch and direct the stretch or direct range of motion. It's worded in the thing. So that was kind of one of the debates. It's like, but should we? And is that still a form of conditioning that crosses over the line? And are we prescribing a set of exercises for them to do by suggesting that they stretch every few hours or, walk around from their desks or whatever it is that we decide to do? Is that considered a form of prescribing or how do we make sure we're being safe and ethical and staying within our scope?
There's two things we should do. One is, did you learn it in school? How to shorten, how to lengthen a muscle? Can you move a joint through all its ranges of motion? Is it tested at the state level? Is it tested at the national level? So if your state exam is the national exam, then anywhere along the way, if you are taken to court, you would win. So if your strengthening exercises deal with contracting an isometric, if you're doing an isometric contraction of a joint, you're great. Or moving a joint through its range of motion, you're absolutely fine. If you're specifically told in your scope of practice that you can't do strengthening exercises, don't do it.
Right.
I don't know of any states that have that in their scope, but it's always good to know exactly what your scope of practice says.
Yeah.
It's also really important to know. And I did talk to an attorney about it. So I think that's pretty solid in terms of how you can get through the whole process of defending yourself if a client, if they hurt themselves and you suggested something and vaguely gave them instructions, there's no hope for you.
Yeah. Okay. So that makes sense. So if I say, oh, you should stretch your neck once in a while or something, then maybe that's not the most ideal situation to leave my
Right.
clients in the hands of them because they're going to do all crazy things with their neck. They don't know what I mean by stretch their neck. But if I have a handout or a video or something like that, and I'm making sure that they're doing it with me, and I'm seeing that they're doing it like without pushing the limits and going past the end feel and those kinds of things, and document that we did this,
Yes.
then that would be, as long as it's in our scope that it's written in. Because I have heard some states say you can't do stretching. So
okay.
yeah.
It should be directly related to what you're working on. You don't want to give like an exercise program to someone, because it doesn't relate to how you're treating this person, what you're doing with this person, what your goals of the session are.
That makes sense.
So stay within the realm of your intention and their goals for the sessions, and stay within what you were taught and tested on and what you know well.
Yeah.
So if you forgot a bunch of stuff, don't try and do a bunch of stuff.
Right. And that goes back to things we're always saying to students. There's no harm in referring out to people, even if it's another massage therapist. They're more versed in this kind of training or this kind of injury. Like, that's why we network with each other and work with each other for that too. So
absolutely.
So it's a lot of it. Like what I'm hearing you're saying is to understand your limitations and work within the parameters that you are well versed in and know really well. So yes, that helps a lot for sure. And so I guess Washington, you got some work cut out for you to send us more things, how to do things better. So.
Yes. So know that there are now assessment codes to build for that don't have a diagnosis.
Oh, okay.
So it's 97161 to 97164.
Okay.
So 97161, 2 and 3 are for levels of severity of injury or complication of the session. And they allow you to assess for 20 to 40 minutes included in that hour treatment. And 97164 is for all reassessments.
Okay.
So you only get the first code for the first time seeing them for this condition.
Okay.
And then periodically for the reevaluation.
That's awesome, because I find we struggle with that sometimes, especially if you're working for a place where you only have this amount of time. How do you properly do an assessment? And it's nice if you're working for yourself, you can give yourself more time, but to know that can be worked into the session is really great. But I know of a lot of people who also will tell their client the first time you might only get a few minutes on the table because we were doing a lot of assessments. So do you approach your sessions at all that way, or do you just build in more time for them?
It depends. If it's the first time I've seen the client ever, I usually add another 15 minutes.
Okay.
If it's somebody who got a re-injury or a new injury and I've seen them before, I'll just incorporate it in the session.
What are some of your assessment tools that you will use on every single person, no matter what, or at least like 90% of them? What do you always look at for our newbies out there?
I always watch people, how they walk in the room and how they sit down and how they get up from seated. I always look at their clothes and how they hang, and it tells me about their posture. And I always lay my hands first on someone to feel for any joints that aren't moving, any puffiness anywhere, and then any other bruises, skin things, things I should be aware of, new scars.
Yeah. Awesome. Yeah. So even if you only have a couple minutes, you're seeing them walking in your office, you see how they sit down, you see how they're closing, and you can assess their skin easily before ever really working on them. Yeah.
It's a great technique to sit somewhere in a park and watch people walk, or downtown when they're in a hurry.
Yeah.
and just get used to saying that person's got a tight left glute, or that's got a hip upslip, or that one has a pec that's really tight, rotated forward. Oh my gosh, forward head posture.
Oh my gosh, everybody.
There's another one, forward head posture.
Yes. As I say that, I'm like, going back again. Every time someone talks about posture, everyone sits up just a little bit better.
That's right.
I told my students, forget the days where you could just be in a crowd and not notice everyone's dysfunction, because you're going to see everything now. The more you get to learn about the body, forget it. Our eyes can't unsee things anymore.
It's true.
I love it. Let's talk a little bit more about the software. I'm actually going to share the screen here so we can take a little look at your website. Have you had anybody saying, oh, electronic, I can't believe, why does everything got to be on the computer? Do you have any pushback from that, or people pretty receptive to it now that I think a lot of people are using it?
I think there are a certain number of people who have been in the profession for a long time that are just really used to paper.
Mm-hmm.
And learning a new way of documenting just takes time.
Yeah.
And they're busy enough that they don't want to take the time to do that. So I get that. I also think, the time will come where everybody else is on it and you're the only one that's not. And people are going to wonder why you're still turning in handwritten charts.
Yeah. Yeah.
Or they just stop reading them.
That's true. So, so I'm hearing from that then, from this software, I can send to other healthcare practitioners from here, or how does that? I probably jump in the 5 steps ahead of how the software works, but I'm really curious about that.
It's totally great. Yeah, there's a system set up so that your report writing is already set up for you. It self-populates with your information, the client's information, any intake information. You get to choose select, or not select. And there's a place for you to write in a couple of paragraphs about how their progress has gone over the last month or so, 2 months. And you can just stack them on top of each other by date so that you've got a narrative report. If anybody asks for a narrative report, you can just send it right off.
Okay.
And then it shows the list of all of their sessions, and there's graphs for pain, activity, and mood scales that self-populate over time. So if you're having clients fill out the pre and post scales, then it'll self-populate a graph. The clients can see it every time they log in and see how they're doing, if their activities are going up or their pain is going down. And it really helps, I think, us know if we're doing a good job if their mood changes. So when people are frustrated and they don't feel like they're getting well and they don't have a lot of hope, their progress is going to go pretty slowly.
Yeah.
But once they've had a few massages, usually they're like, oh, I know exactly what I need to do to feel better. I'm getting better all the time. And so it's a great way to measure progress, because pain doesn't always change first.
Right.
Usually activity and mood change first.
I like that. It's a good way to look at it too. Sometimes we want those immediate results, and there's more things associated with it. So,
right. We can't just look at the pain.
Yeah. So do you know, are you one of the few, if only the only one, that has where clients can look at their charting and that kind of thing? Or is that,
I don't know who else is doing patient portals. Some are doing it just for intake forms.
Okay.
Whereas I think others are also including the ability to log in and look at other things. But from the very beginning, I wanted clients to be able to see their chart notes.
Right.
Because I knew there was a policy coming down the pike. And in 2018, there was a law that was created, a federal law, that says all healthcare providers have to have all client charts, everything in the client chart available for client viewing.
Okay.
So now we have electronic communication systems. That was a product of that. You still have to ask for the chart notes in those. Whereas in mine, the chart notes are all there. They can just click on it and see what you wrote.
Nice. And I know what to me, from a consumer, what set this apart from other software that I see out there is you came out with a software that would answer the need for documenting. The scheduling and the payment stuff was kind of afterwards, because the most important part of it was the documenting and doing it in a compliant way, right? Because sending it via email is not compliant, which is why people still have fax machines, because you can't send things off email unless you protect it, password protect it, and things like that. But I believe that's one of the things that you set out to do, was to create a compliant resource for people to be able to use.
Yeah, they're still going to send things through their email, but it encodes it. So they can read it on the other end once they download it, if they're given permission to. But otherwise, it's a more protected file that goes through your email.
Nice. That's awesome. I'm going to click on the features here, because there's so many. I can't even. We probably spent a couple hours just on this, but so you do have the scheduling and payments portion of it, but that's an add-on, correct? Like the main thing is the charting, right?
That was the most recent add-on. So the charting and reporting came first, and then the billing.
Okay.
Because the billing programs that are out there are so expensive.
Yeah.
And I just wanted something to be available for people, even if they just want the CMS claim form to be able to give to people for their HSA account.
Yeah.
Then this would be really important for that. And so I did billing next, and then scheduling came.
Okay.
So the scheduling just has some room for improvement. So that's what we're working on now. That should go live.
Awesome.
I keep saying any day now, but
I know
it's funny how long it takes.
I know. We're in that day and age of everything has to be immediate. So we don't want to wait any longer.
Right. And when someone tells you 3 months and it's now 5 months, you remember, oh yeah, that's common.
Yeah. So I love it. I'm going to see if I can increase the size here a little bit.
Okay.
Let me a little bit. So I love the visual charting here to be able to mark on the different areas. And if you have something where you can write on the tablet with your finger, can you use that then and write in if you're on your phone or? Yeah.
Yes, if you see at the top, you'll notice those are the symptoms that you can chart.
Yep.
And what's really important to me, not only is that there's color, but that you get to use a different symbol, because if you're printing it out, if you're making a PDF of your SOAP chart and you want to print it out, if it's printed out in black and white, you don't know what it is if it's just color coded.
Right. That makes sense.
Lot of the systems use color coding.
And it's pretty.
And it's pretty. That's right.
And seeing
so there's the graphs that self-populate.
Nice. That's awesome. And
as you can tell, there's always a roller coaster effect. We know that in treatment. But if you just periodically check your dots, it's going in the right direction. So
I love that. Yeah. Seeing all those little dots. So pre-session dots and post-session dots. I love it.
Yep.
Nice. That's awesome. And so all your file uploads that you can do. This stuff's great for people like me whose chicken scratch nobody can understand. So I'm very grateful for that.
And you can dictate. So if you've got a microphone button on your device, you just click that, put your cursor in the box, and talk away.
Nice. That's awesome. going to get this a little bit smaller here. And then this is what I'm really excited for. And I'm really wanting to see if we can implement it too, is that you have, I don't see anything else related to schools this well of all the systems. I've looked on all the Facebook groups, people, what are they suggesting? And just the ability of being able to communicate with the students and comment on their charting. And I think this is pretty amazing. And so did this stem up from you just being an educator, or did you have people asking you for it, or? Yeah.
No, I've been teaching since 1988, and it just seemed really important to me to teach charting from the beginning. And I think schools and teachers need help on how to do that. It's not something that's been in the field of massage for generations.
Yeah.
It's been in the field for a decade or two. And they weren't teaching it when I started teaching at massage school. So it was really necessary for us to really organize things and figure out a way to help teachers teach charting in an easy, informative way that's not intimidating. I mean, it's true. We don't get into the field to do the charting. It's not a paperwork-oriented type profession or professionals. So we've got to make it as easy as possible.
Yeah, absolutely. I love it. Very easy to manage. And I love that you can have all the faculty in there and all the students. And I think it's amazing. So just talking to see how we can implement it. Just trying to see, because I know you can do it through the cell phones, right? And the students could access their charts and stuff like that through that. So
absolutely.
We'll have to take a mini walkthrough again to see that. But
of course.
Yes.
Yeah, I'll do any personal training for staff at schools that you want. So I'm really available to help out.
I love it. I love that. And if everyone can see in the corner there is a 21-day trial for anyone who wants to try it. And the only thing that you said is I'm going to pause this sharing for a minute. The thing that you said is going to be updated is more of the scheduling and payments, right?
Right. Schools have not had scheduling and payments. It's been something that we've tried at various points in the year. And over the years, I should say. And so I have a different team that's working on this just to really dive into scheduling with more experience and how we can make it work for classes, because it's a much more complicated system being in the schools than being in a clinic.
Right.
We think it's the same. But students will go from clinic to clinic if they miss a clinic, or some people want to give students the choice, or clients the choice of students. Some want it to be blind until the day of. And so it's really got to be fluid and adjustable. And so that's what's been kind of holding things up.
That is a challenge for us too. And being a school, we're giving the clients to the next available student and trying to balance it. And sometimes it's hard if we let too many cooks in the kitchen. We don't want too many people doing that. So I really I like all the options in there. So anyone who is interested in the 21-day free period as a practitioner or a clinic, or if you're a school and looking at this too, all that information here is on the Hands Heal EHR.com website. And Diana's is ready to help you implement it into your practice. She's personally promised it right here, folks, to do that. So, Diana, is there anything else you'd like to comment about either the software or any advice for people out there who are still kind of on the fence about documentation before I ask you your hot seat questions for the day?
Oh, that's right. Oh. No, you asked really good questions, and I feel like we kind of addressed everything. You got my whole life story.
Yeah. That's it. We know everything about you. Everything
That's
about
right. I
you.
have no more secrets.
No. Anything coming up? I know COVID's messed up some stuff. AMTA
Oh.
convention was canceled, and but anything on the horizon where we might be able to see you at an event or anything? You hearing anything going on?
I'm really hoping that the schools will be able to have their school conferences in the spring.
Mm-hmm. Yeah.
So if they are, I'll plan on going unless they're in some hot spot.
Yeah. Hopefully the spring things will settle.
Yeah.
Cross fingers.
Yeah, and just to put it out there, King County is 80% vaccinated.
Wow.
I know.
That's amazing. That's
And
amazing.
Washington as a state is 70% vaccinated.
Wow. See, you guys doing all that. Trendsetters.
That's right. Come on over.
Come and visit. Yeah, absolutely. All right, Dana, here are your hot seat questions, and we want to find out even more about you. So, which talent or superpower would you most like to have?
I thought about this long and hard because I thought, automatically I would say healing. And then I thought, really, it feels like you're almost there, just not like, boom, you're healed kind of thing. So I would say intuition. I would love to be able to read fortunes and be, have magic with the cards. And I just think it's kind of cool.
I think it is really neat too. I love watching people work their cards. It's pretty cool.
Yeah, I know.
Awesome. If you weren't in the massage field, you weren't a massage therapist, what would you most likely be doing?
I want to weld.
Nice.
I have played with making jewelry, but can you imagine like a great big life size, like not life size, but human size bracelet or something with, and then taking like big gemstones. And just, hanging them from the charm bracelet or setting them in a ring or right? Like, wouldn't that be cool?
That would be really cool.
Yeah.
You'd be like the Choluli of welding. Then we could all your stuff will be on display everywhere.
Wouldn't that be great?
That'd be awesome.
Yeah.
I love it. Now we're gonna have to see something from you. I just waiting on that. If money or circumstances weren't issues, where would you most like to live in the world?
Now, I realize you said the whole world, but I've been really focused on, I want to retire in Santa Fe.
Oh, that's nice. New Mexico's awesome.
Yeah, it is. And the art there is tremendous. And I love anywhere in the Southwest because of the native population and beliefs. And the art, native art is my absolute favorite. And just to be surrounded by that would be beautiful.
Oh, that's awesome. Well, when you come out to Arizona, make sure you stop by here. So,
I know, right?
Yeah.
I grew up in Tucson, so.
Everyone's got that Tucson connection. So many connections there, Tucson.
Yeah.
And you would have a really good market there with your big jewelry, I think. They have the gem store there every year, the gem show, and people love that stuff. So there, see, you can kind of retire in Santa Fe, but come down to Tucson again, sell your wares. I got your plan, Diana. Don't you worry.
Okay. All right.
What is your most treasured possession?
If it can't be like people or my dog.
Yeah.
If it's a thing, it would have to be my art.
Okay.
What's
your medium?
I've always traded for art with massage. It's so personal.
Yeah.
And so I just really like things.
Yeah. Oh, that's
that are beautiful.
Yeah. That's nice when you can look at pretty things.
Yeah.
That does help. Helps
that have a story, that have a person behind it.
Yeah.
That you have an experience with, especially.
Oh, I love that. That's awesome. I'm almost wanting I'm curious about one of the sculptures behind you, but I think we'll have to find out next time with Diana.
I did, here, I'll go this way. I did make my own drum.
Oh, cool. You are very crafty in so many ways. Look at you.
It's from a Pinto horse.
Wow.
That's with part of a horse tail hanging from it.
Oh my goodness. Wow.
I know.
Woo.
That's cool.
It is cool. It's awesome.
Yeah.
So the last hot seat question, what would you tell your 18-year-old self?
Oh, I was hoping you wouldn't get to that one.
It's usually the possession one that stumps people, and they don't like that question as much. This one.
Oh no, this one is hard. I had a very interesting 18 was I would just tell her, get out of Dodge and get sober.
Get on the road.
Yeah.
Get moving.
Took me another 10 years.
Yeah.
That I could have done without.
Yeah. Well, it's where you learn your lessons though too, right?
It is.
Makes you who you are later on.
It is.
Yeah. Mm-hmm.
Yeah.
For sure.
Yep. But I think the fact that I'm a survivor does really shape who you become and why you do what you do.
Absolutely. And look at you now, like influencing all the massage therapists everywhere with your advocacy and your education and your writing and your everything else that you come along. So yeah. Thanks for all those life lessons for yourself, because you got to where you are here, and we're reaping the benefits of it. So
good. As I turn a little red.
Well, Diana, I want to thank you so much for taking the time out today to talk with us. I know our students are going to appreciate this information, and our school and anyone else watching as well. And anyone who's catching the broadcast later, don't forget we go live every Friday at 1:00, most Fridays. And we'll catch you next week, everybody. Bye, Diana. Thank you.
Bye. Thank you so much.